I'm Darcy Foreman. I'm a global project manager here at Health Decisions, and I am responsible for the execution of global clinical studies. As global PM, it is important for me to keep studies on time and within budget. HD360 really enables me to do this efficiently because I can track my metrics and my key performance indicators for both the overall study, my sites, and my internal team members in real time. I log in first thing in the morning and my up-to-date metrics are there, ready for me to dive in and start my analysis. Having over 15 years of clinical research and pharmaceutical experience, I've run several clinical studies in the past where I've spent all my time pulling the metrics from various sources just to start my analysis. For example, I'd have to pull the enrollment report, the screen fail reasons from a different source, my query metrics from data management, and everything would be in different places. I'd have to pull it all together to really then start diving into the whole picture and look at what was going on and what trends were going on in my study. HD360 really provides an efficient way to manage a study because all of that data is there. It's there for me every single day. I'm not spending time putting my reports together. I spend all my time doing risk management, contingency planning, trend analysis, and really diving into the issues of how to make the study run more efficiently, and there's complete visibility of what's going on my study team. I think the most critical piece of HD360 for me is the dashboard. We define the dashboard based on a study-by-study basis, defining what the key performance indicators will be for each study so we know what we need to look at and what the triggers might be. I come in the morning, the first thing I look at is that dashboard, and I can easily identify where I need to focus my team's attention. I have complete control over where I put my resources on my team because I can look and, for example, look at an enrollment issue at a site and see that they're having some issues with a high screen fail rate or they're not recruiting like some other sites are. We can focus our attentions on identifying what might be working at some of the sites that are not having the issues and doing lessons learned to share those best practices, or just look at the issues within the site to determine what needs to be done. It really allows me to be proactive at managing my study instead of reactionary when the data would come out 3 weeks later in classic systems. HD360 has really been beneficial for my sponsors. It provides full transparency so they see what I see on a daily basis. They get to see the metrics, where there might be an issue, where things are going fantastically. It really allows my meetings with the sponsors to be much more efficient. I don't have to spend half of my time giving them an update on where we stand. We can really dive into just talking about where we're headed and what needs to happen to get it done. It's not spent with the updates. The system itself is set up to be role-based, so say you have a CEO at a sponsor that has 4 studies that are being run within Health Decisions. We have the ability for that CEO to have a view of all of the studies that HD is managing for that company. So he can come in on a daily basis, look at where each study stands, and that's the customized view for his dashboard. Whereas the study manager that might be running just one of those studies has the ability to see the more detailed aspects that are really critical for that role. Both also internally here at Health Decisions, my CRAs get to see a view that is specific to the sites that they're managing. It really allows everybody to just have the information that they need. They don't have to dive through the weeds to get it. It's just real time right there, and it just provides a lot of flexibility and efficiencies all around. HD360 really allows me the transparency to manage my studies efficiently. It provides me with complete visibility so that I can focus on the speed of execution and delivering high quality work day in and day out.